Hi guys, welcome back to my YouTube channel. Thank you so much for the support that I've been receiving following the last video that I posted on autism. In that video, I also mentioned one of the tools that we use as health professionals to actually screen development for developing children. With this platform, what I aim to do, like Julius Malema, is I aim to decolonize information, and today I'm coming with the information on the road to health chart. And one of the things that I want to mention about it, in Zulu it's called IKHADI LOMGOMO. I'm still trying guys with the other languages. The Lord shall help me, but I was gonna be able to tell you guys the name of it in other languages, but for now, please forgive me. So why is this card so important, and why do you always say Guti Spateleni Lona, bring it to your clinic visit? What is it about this card that is the thing that makes us as medical or health professionals to say we want it all the time? I'm also gonna say this is not medical advice, but just to empower parents. Also, this video is for parents, people who are going to be parents. I know during COVID, I gave birth to my daughter, and that was a daunting experience because I felt like, oh my goodness, my mom is not there. Do I know enough? No one could visit me. So I know the stress you'll be later or going to give birth, and you like asking yourself if you know everything that you need to know. Times are changing. We don't always get to stay with our parents. So I'm hoping that this video is going to help you know what to do, know what to monitor with your child as they develop. And then also just highlight some of the important things that we look for in the road to health chart. So let's start. The road to health chart, you might get the blue one, or the green one, and the pink one, pink orangish one for girls. It's issued in government hospitals. It's issued for free of charge for every child that is born. And then in private sector, they also issue a road to health chart. It's different. I remember NOMS one is like black, random, I know, but the Netcare one is black. Some of them have the white one, but every child who's born needs some form of a road to health chart where their birthing history is actually recorded. So if you look the booklet, I'm gonna go over the booklet one. If you look at it, it has the child's name, and then the visits, the doctor's visit. Guys, please immunize your children, because like now there's a breakout of mumps, uzakika, and one of the reason could be also that some of our kids are not vaccinated. So there are posters out even within the Department of Education to say, let's vaccinate our kids for mumps. So the first page that you'll find after the name part is vaccination. And then it tells you when actually this child should come in for their vaccination, or it has from 11 months and up to 12 years. And the doctor or the nurse, whoever you go to, would put the date of the vaccination there, and it helps just to track, especially when the child goes to school, to know that they've had all their vaccinations, because some of the conditions are contagious, like mumps. And then the part I want to focus in, yes, there you're gonna have your child's name and surname and everything else, and your and how many kids you have had, all that information. But today I want us to focus on page 6, which is the neonatal information. And in page 6, one of the information that we put in there is your birth weight and the ABGA score, as well as some maternal history. What are we looking for when we're looking at birth weight? So I'm from speech therapy, and in speech therapy, when we are monitoring a child, for instance, one of the guidelines that will give us is that we cannot discharge a child who's less than 1.8 kg. Like I said earlier, it's not medical advice, but it's to inform you guys why we do what we do. So when a child is born, one of the things that we want to look at is the birth weight, and it's also the ABGAS, and it's also in terms of the terminal, like when was this child born? Was this child born prem? Prem is before anything before 35 weeks is considered premature. So if the child is born prem, for instance, in speech therapy, one of the things that is my focus is feeding. So umntwana who's born before 35 weeks, is suck swallow synchrony has not developed. What do I mean? The child might not be able to suck properly. You'll see a speech therapist coming into your ward and putting on gloves and actually putting their tiny finger or the small finger on your child's mouth. What are they trying to assess for? They are assessing if the child does have the suck, because that will determine if they can latch properly on your breast. So if the child is born before 35 weeks, 32 weeks, 20 weeks, we've had kids that are born 19 weeks. So normally the child would then go into an NG tube, what we call a nasogastral tube, because they may not be safe to feed ngomlomo. So that is why most of the time we're gonna say what was the child's birth weight, and then also one of the other things that is also on that same page is actually maternal history. We want to know if umzali had hypertension or any type of history that might have led. For instance, we're going to ask you also what was the type of delivery. Did you have an NVD, which is your normal vaginal delivery, or did you have a C-section? If you have a C-section, was it elective Caesar or was it an emergency Caesar? All of these things are trying to give us history around what was happening around the birthing process. And then one of the other things that we're going to look for also is what we call ABGA score. So what is an ABGA score? It's a score that is out of 10, and it is in your road to health chart. And what the doctors who actually write the ABGA score, the doctor or the nurse, it's actually a test, ABGA score. They take it at 1 minute, and then after 5 minutes, and then sometimes after 10 minutes. So it tells us how much the child tolerated the birthing process. And by that, it means Guti, they're gonna look at the child's skin color. They may look at the child, are they able to breathe? Like everything regarding the birthing process. And most of the time they say that anything lower than 7 means that the child may need to get medical attention. There was a joke the other day, and the reason that is making me to also do this video, one of the guys by the name of Umhlonishwa said, if you're gonna date someone, also please look at their ABGA score. I was laughing, and most of the people who were laughing were people that were in the health science factor, because ABGAs, research is saying that ABGAs are not an indication of IQ later on, but they do tell us about the child needing some form of intervention during birth, and most of the time is because of something happening to the child's brain. So they are not, like I say, guys, I'm not a medical doctor, but researchers said Guti, they are not an indication of the child's IQ later in life, but they do indicate a need. And that is why in speech therapy we have something that is called high risk register. In fact, it's used across disciplines, but within high risk register we group all these conditions that places a child at risk, either for hearing loss or speech delay. And one of the things that places children at risk is prematurity, is low birth weight, because they do contribute to the child's development. So like I say, guys, when a child is given an ABGA that is less than 7, like 5, it might be an indication that the child needs to maybe get some oxygen. Like I say, Wuti ABGA would look at certain things. So one of the things they're going to look out for is the child's heart rate, it's the child's muscle tone, ama reflexes, abantwana, the skin color, and then each of these things is going to be given like a 2, and that what is going to give you the score of 10. And why do children have low ABGAs? Most of the time it may be due to what we call asphyxia. So what that means is that the child struggles to breathe, or they may have aspirated. Sometimes meconium aspiration, you may see it on your thing or on your birth card. That means during the breathing period, umntwana swallowed the liquid within your stomach. Depending whatever that was in the stomach during the birthing process. But okubalulekile is to know that means the birthing was difficult for the child. So and then why am I sharing all this information? We get parents coming to us and saying, I gave birth and my child is now 3 years, or my child is now 2 years. Why am I still needing to be monitored? Because when a child is in the high risk register, what the protocol with some hospital or most hospital is that then we need to monitor this child till 3 years, because what we're trying to do is to actually find out if this child is developing normally or they are matching their developmental milestones. Because once there's a delay or there's an aspiration at birth, it may affect the developing brain. So we want to catch it early, we want to intervene early so that we build that child's pathways right now. But what we want to make sure is that we build the child's skills, the barriers that could be affected. If it's communication, we want to catch it early so that we start teaching those precursor skills that are needed in language. So like your turn taking, your eye contact, we want to teach them early so that they can eventually catch up with other kids. So it is important that when we are having this road to health chart, we know Uguti, it's not only for the health professionals, it's also for us as parents. I sat and read some of these things and I was like, I missed some of this information. So as you go through, like I say, guys, this card is not only for immunization, but as you go through, you find where they'll ask you questions about HIV, and that's also just so that we know who to get medication. Now in South Africa, medication is free in public hospital, or nevirapine and all those other medical treatment that prevents ingane from actually contracting HIV. So that's one of the reasons why they will ask those questions there, so that they can protect the child. And while we're there, one of the things that we were always advised, they will take us HIV and test. And I remember going in counseling with it is important when we have this road to health chart to use it for ourselves as parents to check the information. And then I'm gonna go forward with some of the things. The HIV one, what is important is that right now there are medication that can be given to a mother if their RVD status is positive, and it can protect the baby from contracting HIV. And while you are breastfeeding, they will give you information about maybe not mixed feeding. They will tell you why you shouldn't be mixed feeding. Especially, they will say to you, maybe choose maybe a bottle feeding, or you can choose breast only, but maybe not to mix feed. But the doctor or your nurse can actually go into details about the why. But just know that that's one of the consideration that you might have to know. And one also other reason this page is actually important is that this is page 7, is that when the child is coming in, they will do certain tests for the child. Some of them, they are done at 10 weeks, if I'm not mistaken, but they do certain tests with the child to just make sure that the testing...
You didn't play with me.
And then when you go on page 10, your road to health chart, you're going to find that they're going to talk about feeding, and then they'll ask parents, or one of the recommendation is that can parents please exclusively breastfeed till 6 months of age, and they speak about the benefit of breastfeeding. Guys, breastfeeding is life. I mean, I have to, like, there were times when my skin was acting out and I was there like with some of my breast milk. Norm would be having some form of eye infection. They might go breast milk. So breast milk on everything. I mean, I cannot advocate enough for breast milk. Other than that, Uguti, I'll be sleeping at night and she'll be waking up. I just don't need to wake up and go to. I just take the little one, put them on the boob, cry, anything. But yes, they recommend breastfeeding, and that's nice information. And they actually explain here, Uguti, what is exclusive breastfeeding. That means, Uguti, you are breastfeeding alone, like you're using that pela. Ingane that are below 6 months, according to the information that we have, health information, it says that they should be exclusively breastfed. Meaning we shouldn't be introducing food, because also from a speech therapy point of view, you want a child to be ready for oral feeding. You want them, physios will tell you that they want the child to be able to sit by themselves, so that it lessens the risk for aspiration where the food goes into the wrong pipe. So exclusively breastfed. And then they also explain here about play, communication, which is where I am going, Uguti. This chart is not just for us or for professionals. It also for parents as us, guys. It's telling us here that we should be communicating with our kids what to do. What are some of the activities that you do with your child? Furthermore, it also gives us some of the things that you must do when your child has diarrhea, for instance, when your child is vomiting. What are some of the things that you can do? I was terrified. I don't know about you guys, but when COVID hit and my mom couldn't come, I was like, Jesus, what am I gonna do with a whole human? Like a whole human to me. So like it helped that I had read some of these information, because even when some of the things, Norm at one point vomited at 1 or 2 a.m. in the morning. She did a whole projectile, and I was scared. Like, so some of the things that helped me was knowing some of the information that is here. So it also goes to some of the feeding and where should you go when you are finding out that there is a delay in any of the areas. And there's something that is called a developmental screening that you're going to find on page 13. It's going to say, can your child see? That is vision. And then it's going to ask certain questions about hearing. For instance, it would say, can your child hear and communicate as other children? Does your baby respond to certain sound? Do they turn their head? And then it's also going to look into motor development. Motor development, guys, are they crawling? Are they standing? Are they holding on to something? Because this is also going to assist you to screen if there is a delay, so that when they have that early intervention in Kulumeng. So and then got the same page at the end, it will tell you that refer your child to the next level of care. And then it will say, if you are suspecting communication, speech and audiologist, if you are suspecting motor, kanjalo. And it's important because sometimes we these things don't come easy. Or before I became a speech therapist, I didn't know I could read, or I found this information. Speech therapy, even the career wasn't something that I knew about. So guys, I'm just gonna run through to not make this longer than what is expected. Then there is a slide or a page where we monitor the child's weight. And what you need to know, or I'm a dietitian that guided us, they were like, our kids should remain within the green. If they exceed the red part, that child might be at risk for obesity. If they exceed the red part going as anti, that means umntana going below the red line or just below the red line, that means umntana is malnourished. But at the same time, refer to a dietitian. So where am I going with all of these things? Your Road to Health chart can actually inform you so many things about your child development and where to refer to. I hope this video has helped to try and clarify why we need this information. Even in school, when your child goes in, we're going to look for this card, because some of the immunization go up until the age of 12, and we need to ensure that the children are immunized correctly. Love you guys. Thank you so much for sharing my videos. I hope you have found this one also informative, and we are trying by all means to decolonize information and ensure that it is accessible to everybody. I love you. Don't forget to like, share and subscribe. Bye.